Welcome to our program on Kardec Radio.
Hello, everybody. Once again, we are here. As usual, we are not in London, but we are on time. The Big Ben rings there, and we open the link here. So, once again, with our friends and our Dr. Sergio Thyssen, again with the second part of his talk, and I hope you are fine. I hope this finds you well. I would like to welcome our brothers and sisters from America who are joining us through the Kardec Radio. Thank you very much for your time. Also, our Irish friends, British friends, thank you very much, and the Brazilian friends as well. So, thank you very much. Dr. Sergio, once again, thank you very much for being here with us. It's an honor to have you 2 times this month. So it's a lot of content to share, a lot of to think about. And our dear friends here, Darnell, I can see here, Darnell from Texas, you're already here. Thank you very much, Darnell. So do not lose any time. I will do the initial prayer, and we can move on direct to the speech. Once again, I would like to ask everyone to sit comfortably, have a deep breath. If you want, if you can, close your eyes, open up your heart, and lift up your mind, making connection with superior spirits, with our mentors, with the mentors of this program. I'd like them to enlighten Dr. Sergio Thyssen today. To all people who are live with us and will watch this video in the future, may this prayer reach them. And also, may this prayer reach all brothers and sisters who are suffering at this moment in a hospital, in an orphanage, in a home care, on the streets, or alone at home. So be it. Amen. Okay, my dear friends, Dr. Thyssen, I don't want to take more time from your presentation because doctor needed to leave almost 5 to 2 hours. So thank you very much, Dr. Thyssen. Just reminding you, today's topic is the part 2 of the triple frontier between medicine, modern physics, and spiritism. Okay? If you want, in our story, last Tuesday, we had the first part of this talk. Okay? And also, if you have any questions, please write your question in the comment box. If for some reason we don't have time to answer a question online, I will send those questions to Dr. Thyssen. He will reply, and we post later here the answers. Okay? Thank you very much, Dr. Thyssen. It's all yours, my friend. Thank you very much.
Thank you. Hi, my friends. Hi, everyone. I am very satisfied, very glad to stay with you again. I remember that last Tuesday, we talked many things about this triple frontier. I will put the slides again, but fast, only to the people, or all of you can remember about our talk last week. Spiritism, physics, medicine, something about the history of medicine in this world. Many patients of mine with very severe problems in internal medicine problems. Something about medicine, because we have many different diseases, different diagnoses, different sufferings because of many different medical problems in terms of physical body and in terms of mental illnesses. I remember I show you many very nice books from very interesting authors and contents about this kind of frontier, spirituality and medicine. Physics of the soul, the basic code of the universe between those three different sciences. We talk about what we have in classical mechanics in terms of Isaac Newton and many others in some time ago. We share with you the idea of what we have before the modern physics, classical mechanics, optics, electromagnetism, thermodynamics, and now the new science, the new physics, because we have just yesterday, 14 December, we complete in the history of humanity, in the history of science, in the history of physics, 120 years of development of the science from Max Planck to those days. Quantum mechanics by Planck, theory of general and special relativity by Einstein. Something about Planck, Einstein, Niels Bohr, Louis de Broglie, Erwin Schrödinger, Max Born, Heisenberg. This is my colleagues. I like so much this photograph. And I remember to show you Marie Curie, the only woman in this meeting near Brussels, in Belgium, in 1927. Those are the men that did the revolution of science by the ways of modern physics. I remember, can you see 14 December 1900 by Planck. This is the man that began this new science to humanity. The ultraviolet catastrophe and many other things. Albert Einstein, Louis de Broglie, Thomson, the atom of Thomson, Niels Bohr from Copenhagen, School of Physics, different ways to see during the development of physics about the atom in terms of the constitution of the atom. The Werner Heisenberg. This is the equation, the first, the best, the more important equation in the history of the physics. The equation of Schrödinger, Erwin Schrödinger. It's Schrödinger. Here, the idea of the different ways to see the atom, the more important and simple constitutor of the matter, not only the matter from the chairs, the tables, the books, ourselves, but matter in terms of spiritual world too, because the spiritual world, we have matter, we have molecules, we have atoms, and we have quarks and leptons inside those atoms, including the spiritual realm. the antimatter, the positron, for example, near Geneva, the particle accelerator. And here, I remember that we finished last week our little talk. In this photograph, the idea that we have from those days to the future, the idea of all of the people during the evolution of humanity in terms of universal science, we will need to study physics in a very nice understanding and very nice forms to understand this big science. And I refer the mother of science. Here, Spiritism is a science that deals with the nature, origin, and destiny of spirits, as well as the relationship with the material, corporeal world. Allan Kardec and the main books of the Spiritism codification. Do you remember in the question 27 of the Spirit's book, what we have in the universe? The answer: spirit, matter, and universal cosmical fluid. Creation by divine paternity of the spirit, spiritual evolution. We need to recover as an idea, very special idea, the spirit evolves universal science and love to sidereal perfection. And we are trying to do the same independently of the bad situation in evolutionary aspect of this humanity. One soul or spirit, many lives or reincarnation. And we have, by one author, Emmanuel, in one specific book, the idea that on Earth we have 20 billions of people on Earth. 20 billion of souls with moral deficiencies gathered together for re-education and regeneration according to moral and ethical codes of the universe. More or less 7.5 billion of incarnated, and the difference 12.5 billion of people, of human spirit, human people in the other side of our world. We are looking for the inner enlightenment and substitution of vices by virtues. That's the book Roteiro in Portuguese, from Emmanuel, from Francisco Cândido Xavier. When we stay some minutes in the Spirit's book, we can understand the idea of the hierarchy of words according to Spiritism. We have primitive words, and as on earth, we are a world of tests and atonements or expiations. But we'll have the future, and we'll grow up, step up to different conditions in terms of the big world and all the human beings that will live and continue to stay here. The words of regeneration, as in the future of the earth, and happy words and pure words. Do you remember we have billions and billions of stars? We have trillions of planets. In this galaxy, in the galaxy where we are in the solar system, we have Andromeda. In Andromeda, we have 5 trillions of planets. And possible, in all of them, we have different humanities and different kinds of people and humanities in different situations in terms of spiritual evolution. We need to consider that on Earth and about our humanity, this is a semi-primitive world. Here, a hospital planet, a school planet too, obviously. We are hill souls because of selfishness, proud, vanity, evil passions, violence, wars, aggressions, and many big problems in terms of human reality and human choosing an action during all of our lives, during all of the time of our big time for evolution. For example, as a spiritist, I am working with many people in the same frontier. We are linking during the last, for example, 4 decades, just in Rio de Janeiro, Brazil, between physics, between spiritism, between the activities in the spirit societies and medicine, because many and many spirit centers around the world, and it's very common in Brazil, we have meetings to care of the people that are arriving in the spirit society, asking for help because they are sick, because they have the same problems in medicine that the people that are trying to have the medical approach in hospitals and clinics. This is a photograph of this spirit society. So, in general terms, we have this obsession or the treatment of the spirits related of the cases. This is a big point. I would like, I don't know, maybe to introduce this idea or not. The idea is when we have a cancer case, when we have epilepsies, Alzheimer's syndrome, when we have acute coronary infarction or coronary heart disease or cardiac or cardiovascular insufficiency, or when we have one different neurological chronic disease, always this is karmic problems. We understand diabetes, hypertension, depression. We do not have till now the true idea in a common medical approach. Where is the cause? What is the cause of many different medical problems in terms of problems in the physical body or mental problems? We don't know. We have many epidemics, for example, depression and suicide all over the world, but we don't know exactly where those aspects come from. And always, when we open each case with the mediumship group, we detect many problems in different lives in the past lives. And we find different spirits, different spiritual contexts. And when we used to help those spirits that only mediums can see, because the common doctors, they don't know nothing about this in the common hospitals all over the world. So when we care of those spirits, when we clean the spiritual reality of each one patient, the outcome, the clinical evolution comes completely different. And I would like to tell to you, as one information and together with one kind of reflection, I am visiting, sending to the scientific committee of the most important medical congress, for example, in cardiovascular medicine and World Congress of Psychiatry, this kind of experience, because those scientific committee, they are open to different approaches to help the common scientific idea of the medical problems to new one that comes from different groups around the world. For example, I stay in Lisbon last year. I stay in Jerusalem just in a meeting, putting together spirituality and psychiatry. So this is the way that where we have some experience. Independently of the mediumistic meeting, to do this obsession, to care of our friends in the other side of life, linked together of my patients, the patients of my colleagues in Rio de Janeiro, we have the passes, the fluid therapy, and the use of spiritual magnetism, cure of healing process by the hand imposition, trying to change the molecules inside the brain, inside the heart, inside different organs to change that material, organic reality. And this is our main job. But I would like to tell to you that in the Spirit Society, this approach is free of charge. We are doing this for many years because we love, because the Spiritist group, they love to help. Our recompensation is the happiness of the recovery in terms of different prognosis in medicine. For example, this 4 years ago, this is one article about the effect of Spiritist passive energy therapy in reducing anxiety in volunteers. And now, when I enter in the NIH site of medicine from United States of America, the best of the world, and when I put the words medicine and spirituality, I have immediately, in seconds, 20,000 of papers, of articles from different universities, the best of the world, around the world. Here, this is my one of my first experience in Munich, Germany, 6 years ago. I will show you. My name is in the bottom. The subject: influence of discarnate people in mental diseases and its respective approach. This is the best European Congress of Psychiatry in all of the years in the calendar. Here, another meeting in Madrid, Spain, 6 years ago, the World Psychiatry Congress, the best. Here we have 4,000 of colleagues, psychotherapists, psychoanalysts, psychiatrists, psychologists from all of the countries. And I could share with my colleagues about the influence of the spirits in the mental problems. Annals of Internal Medicine, one of the best newspaper in medicine, the efficacy of distant healing, a systematic review of randomized trials. Distant healing is the effect of the prayer. The distant effect in terms of healing and many different diseases and medical problems by the prayer and the mental and fluidic and magnetic radiation directed to the people that may be in the other side of the world. This is one of the best, one of the better news paper in medicine. We need to remember that when we are incarnated, we have a triple aspect. We have the physical body, we have the perispirit, and we have the soul as a star, for example. No? We need to consider that when we have a cancer, one tumor with 10 centimeters, for example, they surge because of one mitotic cellular division. And if the immunological system it do not goes to put outside the body, we have the growing in a big tumor in the liver, in the brain, in the lung, and many and different aspects of human body. But we need to consider that the tumor, the medical problems, always they come from the soul and bad choosing, bad actions in contrary or against the divine law. And after this, the problems that we create to the other people because of action and effect, action and reaction, immediately we need to consider some kinds of destruction of the intimate structure of the perispirit. And when we take another body, when we reborn, dependently of our new actions and thoughts, feelings, and many moral things, we will pass to the physical body our disturbances in our peri-spirit related to our bad actions in our old reincarnations. Here the same. In the medicine, in the majority of the cases around the world, all of my colleagues understand only the physical body. In the future, we'll have one resonance, magnetic resonance, to see the perispirit from now, 20 years in the future. We will have how detect our moral problems and our consequences in the perispirit before they will stay and invade the cell world of the physical body. Do you understand? We will see this in this life or in the other one, in the next one. So, in our medical research, as in the Spiritism, we would like to point this aspect. We are spirits or souls. We are immortals, and we live many lives. Reincarnation is a fact. Past lives therapy. We can detect the old lives of our patients. On earth, we live in two different worlds or realities, the material one, this one, and the spiritual realm when we are in the after death. We have now many different scientific evidences of extracerebral consciousness, immortality, and reincarnation as near-death experiences, communication with comatose patients. This is a new way to understand spirituality linked to the physical body. Past life therapy, spiritual healing and medicine, as we are working during the last decades. Nowadays, we have power to understand mediumship, the trance state by neuroimaging, a contribution to the idea of dissociation from the body in terms of the soul of the mediums. We have many different to study, but I would like to pass. This is only one superficial or simple idea. When we look for this, we can imagine this is a woman, this is a youth woman in a very nice aspect because of the light, because of the translucency. This is a good spirit that we can see around us every time, and we can see many of them in a discarnated team around the incarnated team in the mediumship meeting to help our patients. And I would like to tell you that I don't need that the patient stay here in Rio de Janeiro. We are caring of people because of this very nice structure to help the people. People from Australia, New Zealand, from Argentina, Boston, maybe from Ireland too. This is a bad aspect of this word in the inner context with very important aspect of suffering. This is the darkness, and we have frequently to help these spirits to benefit the patient here between them or in a distant country, asking to us to help, for example, a little man or woman with leukemia or with Hodgkin lymphoma. Frequently, we have spirits. Always, we are dealing in those meetings with different kind of spirits, like this included. But we have good aspects of life. And those are in an astral city, spirits that help us to help our patients to care and to try to cure, helping them in the Spiritist society. This is some kind of imaging, magnetic resonance imaging, functional, studying comatose patients without some big part of their brains because of tumors, of neurosurgeries, and many things. Here we have the best paper in terms of medicine around the world, the New England Journal of Medicine, we can understand how to do some kind of conversation utilizing images in resonance with comatose people, as we can see here. We can, with utilizing mental imagery tasks in the New England 10 years ago, how to light and to understand what is yes and what is no in healthy controls and in different patients with very severe cases of coma and destruction. And so we can see these different ideas to us. The New England Journal of Medicine, God at the Bedside. This is a very interesting review of those aspects. Should physicians prescribe religious activities? What is the answer? Yes, we are dealing now with religiosity, spirituality, and medicine in terms of empathy, in terms of compassion, in terms of meditation, in terms of prayer, intercessory prayer. The Lancet in England, religion, spirituality, and medicine. So in my practice, as a doctor, as a physicist, and most important, as a spiritist, immortality of the soul, survival of the soul after that, reincarnation, this is one main aspect in this approach, law of cause and effect, action and reaction, communicability of the spirits, mediumship, intervention of the spirits in the physical world, very important too, existence of the spiritual world, physical body, spiritual body or perispirit, and soul or spirit. Reflections to finish this little second approach in the same way. The soul accumulates its experiences of all previous incarnations. Illnesses of the body and mind in consequence of the torments of the soul. Because I remember the last Tuesday, this word is a sick word. This is a big hospital. So the existence of spiritual world, of sources, cause a word, place of life of the spirits. But we are spirits too, and we are changing our places in the past. All of us, we are there, and many of them that are now in the spiritual realm, they will come back obviously and naturally in the future. We will change our places between all of us. Interchange between the two words, reciprocal action among beings of the two words. We are incarnated, but all of that we are doing, thinking, we are spreading mental waves to the spiritual reality around us. And in the same way, all of the people in the healing spheres, in the best spiritual reality, but in the lower reality, including the bad situation spirits, when they think, when they are doing those actions, they act in our psychosphere, creating some kind of reciprocal actions between the two words. So the idea of the law of personal responsibility or karma. Here, mediumistic meetings, this is my hospital and my, when I was born in Porto Alegre, Rio Grande do Sul. Here, I study about the interaction of physics and psychiatry and obsession problems. But in Brazil, we have many different clinics and hospitals integrating the triple aspect of the science. Mediumship of channeling. And I would like to share with you some different case studies, but I will not have time. But maybe in the future, we can program with Esteban, if you would like, one different meeting only to share with you common and real cases of my practice. And I will share with you the cases when they arrive to us in the spirit society. What we do or what we did with them in the mediumship and in the fluid therapy, and then the results. Those kinds of results we are presenting in the best or the very important meetings in terms of medicine, especially in psychiatry. So I apologize. I would like to stay more time with you, but again, I have that compromise with my friends, with my colleagues in the prayer. Thank you so much.
They want to see your case study, so let's schedule a date, okay? Yeah, and we do have here a question is, how does your colleagues manage it? I'm asking because of almost of the doctors that I know have a bit difficult to handle this subject.
In Brazil, Daniela, it is very interesting because we have Spiritism here during many decades. And the people talk about spirituality very commonly. So when I stay, for example, in Rio de Janeiro, in the best cardiovascular cardiology congress in Brazil, the room with more cardiologists interested in some different issues in general cardiology. When we are presenting, or my colleagues in the same frontier, spirituality and cardiovascular disease, we do not have place to the people to sit, because all of when we compare with the meetings during all of the Congress, they have a very clear interest to share with us, because they are sensible, they are interested to understand this frontier. So when I talk with my colleagues in the university, in the hospital, or with my residents, for example, during one session of medicine, and then I talk about spirituality, about soul, about spirit, they respect. Do you understand? Because they know about our credibility, maybe, to know about, because they know about our scientific approach. Do you understand? So obviously, it's not every time so easy but we have different forums in Brazil and in the world to discuss these ideas.
Thank you, my friend. I know you are very tight with them. When we set another day, and you can go, let's say, to part 3, and you're gonna present your case studies.
Okay.
Thank
Maybe
you.
this year, or maybe in the next 2021.
Yeah. Okay. Danny said, happy to hear, and thank you very
Thank
much.
you so much. God bless you. Thank you so much for this opportunity to share about those frontiers. Thank you.
Yeah, thank you, my friends. Stay here, just Dr. Citizen go. So thank you, my friend. Thank you. So another great talk. It's good to see how healing, how spiritism can act associated with science and physics. I know this is a brand new topic, a brand new situation here. Like Daniela said here, it still have a lot of challenge to undergo, and but pizza we will reach then. For those who doesn't know Francisco Cândido Xavier, which is we call very fraternal way Chico Xavier. It is a medium in Brazil, and he wrote more than I don't know how many books, but a lot of books through the automatic writing, okay, channeling this. And one of these books, we have a series of books dictated by the spirit André Luiz. And in these books, André Luiz he's a doctor, and he shared the experience he's having in the spiritual world. So he's sharing a lot of information about how it is, how it's composed our body, and this was written in 1950s, 56, 54, 55. And at that time, what was written in the book, people were considering, oh, this is a nonsense. This is someone is crazy. That's not right. But nowadays, there is a group of doctors who are studying this, and everything was written there. They really proved the existence. On top of which, the university, UCLA, University of California, it is studying these books. Doctors is studying. So many things happen. Also in Brazil, USP University, São Paulo State University, they also studied. So bit we will reach there. It's a long run here, but we needed to do it. Okay, just follow the same trend. I will, if you have any questions here, I'm happy to answer if I know the answer. That's the point. I open randomly Christian agenda. Let's see what message bring to us today. Physical beauty can bring about unforeseeable tragedies for the soul that lacks discernment. Yeah, here it's I think it's make connection what with our talk today, because a person looks like very strong and very positive, but at the end, inside of that person, they are crap. They are so devastated, suffering from anxiety, suffering from I don't know, humiliation, suffering from loneliness. So this person is in pieces inside, but they don't want people see it. So they put a kind of a mask and show, oh, I am good. So many actors we see, people are like envy them in terms of, I want to have this life. This person should be a very happy person. This person should be a very nice person. But at the end, we know they are under drugs, doing a lot of marriage, or even though sometimes they kind of kill themselves. So it's very frustrating how people use these masks and don't show who we are, what we are feeling. We don't have courage to talk to someone because, oh, how am I going to talk to that person? Because I need to put in pressure that I'm good, that I'm strong, that I'm okay. And they end up in serious trouble. So please, my friends, the message today is don't be afraid to talk about what you feel, what you think about. Don't be afraid to express yourself. Don't be afraid to be yourself. Some people are going to get hurt. Some people don't. If you hurt someone, it's because something you are doing not right. Because you are not supposed to hurt anybody. Okay? So if you think you're going to hurt someone, just stop. Think what you are doing, what you're going to say. But last but not the least, sometimes the silence is the best answer. Shut your mouth is the best answer we can have now. Okay? Especially in this time, the spirits we are passing by, we are having a lot of problems, and we need to handle it. We are approaching Christmas, and Christmas for most of us here means family reunion, and we are being threatened to not have this family reunion. What to do? I don't know. It's up to you. What makes you feel better? What your conscience is telling you? But always put in your mind, don't be the one who's gonna spread this virus. Don't be the one who's gonna put in risk your family. Perhaps you're not seeing anybody this Christmas, but not seeing someone this Christmas means you will guarantee to see them for many other Christmas. It's your choice. I'm not in a position here to say what you have to do or what you should do. I'm in a position to help you to think what you need to do. Wait. Put this in a scale and wait. What is worth? It's gonna be very, very tricky. At the moment we have the vaccine on our doorstep, we're gonna get this and gonna die. So think about it, my friends. Okay? Okay, so that's it for today. I would like to say thank you very much for your attention. I do have some announcement. On the 1st of January, which is, let me see, which is a Friday, okay? We will have a special talk from Charles Kempf. This is a union of Spiritist Society of Ireland, Irish Spiritist Federation, British Union Spiritist Society, and they are holding an event in memory of Leon Denis, which is one of the person who helped Kardec and took his job along the way after Kardec passed away. So next year we're going to celebrate like 150 years, and on the 1st of January we will have a special. It's going to be online in Kardec Radio. It's a joint effort of Kardec Radio, Irish Spiritist Federation, and BUS. So you will see this event on both, on all three Facebook pages or in YouTube pages. So please save the date. It's amazing. And we will have someone talking about Leon Denis for the next 12 months. So one person per month will talk about Leon Denis in a joint effort of these three organizations, okay? So please save the date. Let me do the final prayer. So I would ask to everyone to have a deep breath. And I'd like to say thank you for those spiritual friends, incarnated friends who are here today with us. Thank you for your time. Thank you for your collaboration. Please keep us with hope in our hearts, fighting every day, not just for our life, but fighting to help our neighbor. May everyone here have a good weekend, a good week. So be it. Amen. I was thinking like today Thursday, now it's Tuesday. Okay, so I'll see you on Thursday. Nate and myself gonna be here, and we're gonna discuss some interesting talk about Spiritism. So thank you very much once again, and I see you on Thursday at 7:15 Ireland time. Thank you, my friends from Ireland. Thank you, my friends from America. Thank you, my friends from Brazil, from UK, from Portugal here I can see today. Thank you very much. And may you stay in peace. Okay? Thank you, Daniel. Thank you, Texas. Yeah? And I hope you enjoy your day, rest of the day. Thank you. Bye-bye. See you